I'm joined by Elaine Tomkins, who has 30 years of massage experience, has trained therapists in the UK and internationally, and is a scar tissue specialist. Hi, Elaine, and welcome to Quality Health Finder.
Hello, Lorraine. Thank you for having me. It's always a pleasure to talk about scars.
Well, let's jump straight in then. So, what is scar massage therapy, and why should anyone with a scar consider it?
Yeah, good question. I think scars are probably the most neglected area of our healthcare system. We don't talk about them. There's not a lot of advice that's helpful sometimes. So I would kind of define it as more of a management strategy. So, like a therapeutic approach that uses manual techniques, kind of specialized ones, where we start to really help the scar in terms of its healing, its function and mobility. And ideally, with planned surgeries, we try and work preoperatively. So we know that anybody in a very relaxed state with good immune function heals that much better. Their scar is that much sort of more pliable, and it doesn't cause some of the kind of longer term consequences. Obviously, we don't always have that opportunity. So we often see a lot of people post-op that are in trouble. We ideally getting the therapy as early as possible is very, very good, but not always possible. So we work with all types of scars. So we work with obviously planned surgeries, unplanned surgeries such as C-sections, road traffic accidents, anything where we've had some sort of trauma, and older scars as well, because sometimes they can rear their head and just cause an awful lot of dysfunction.
Is there an ideal time for the scar to be massaged?
Ideally, in the ideal scenario, we want to start massaging a scar, well, at home, put it this way, if you are a kind of listener, you want to make sure that the scar is fully healed, that there isn't any infection, that there isn't any redness, and there isn't pain. So you can very, very gently start sort of 2 to 4 weeks. But I often advise people, just to check with their healthcare provider, because what we don't want to do, we all tend to overdo the DI and can really kind of traumatize the tissue. So basically, we don't want to add trauma to areas that have already been traumatized.
Right. So when would you avoid doing that altogether?
Yeah, so I would definitely avoid working on a scar if it's a recent burn, classify burns as scars as well. So recent burn, if somebody is having radiotherapy, the tissues are very, very fragile, and often radiotherapy is post any type of lumpectomy or often mastectomy. So we want to avoid anything there because the tissues are too fragile. If there is inflammation, so if there's redness, heat, if there is a discharge, we definitely do not want to. If somebody has active cancers in the area of that tissue, then definitely avoid. If there's huge amounts of pain when you touch the area, I would avoid. And I think lastly, I'm relating this to older scars because older scars, abdominal scars, surgeons used to use a mesh as a type of reinforcement so that it helps the tissues. Anybody with a mesh inserted, I would definitely avoid that because we don't want to move that mesh, basically. So the
Gotcha.
techniques are very, very gentle and certainly aren't what I think people consider as classical massage.
And what would happen if you just left the scar alone, didn't touch it?
Oh, scars aren't really obliged to be problematic. And I think it's really important, the body always heals. It does an incredible job. It will find a way of healing. If you leave a scar and it's happy, often people aren't aware even, that's pretty good. But it depends on the depth of the scar as well. So the deeper the incision is or the scar or the trauma, we know that the deeper tissues will become affected. So over time, it can contract. If it's across a joint, it will get quite sort of fibrous. It can impact movement. Abdominal scars, if they are left sometimes, will impact the breathing and the function of the hips and the lower back. So when we sort of talk about the therapy, we look at the global picture with somebody. So, for instance, if somebody comes in and has had a knee replacement, we have to address the knee that hasn't been surgically operated on and the corresponding hip because the gait would have changed with the adaptation to the surgery. So it's a It's a very sort of global approach we have.
Okay. And then some people may have had a scar for many years. It's been uncomfortable, itchy and sensitive. And is that something that could be treated? And why is it? Why is it that the skin is so sensitive after all that time?
That's a really good question. And it's something, again, the emotional impact of scarring. It can cause an awful lot of distress because the event is over. You've been told everything's fine. You go back to perhaps your GP or your surgeon, and because it's not sometimes, what's the word? You cannot see these areas on scans. Sometimes you're given medications to offset this strange feeling or burning or itching. So this is quite common with all types of scars. It doesn't have to be a deep scar. So what we know is that when there is trauma to the tissues, the connective tissue sort of underneath what we can see our skin, it houses a lot of freer nerve endings. And with the scarring, the tissue changes. We lose the hydration. It doesn't have sweat glands. It doesn't have oil glands. We've got this credible structure that's stronger than the tensile strength of steel. And yet, it's kind of dysfunctional to some extent. So if a scar becomes very, very dry, and it doesn't have to look flaky because it doesn't have its own lubrication like healthy skin, doesn't have any sebaceous glands, that scar can get dry, and that can trigger this kind of itch cycle, kind of neurological level. So those tiny receptors underneath are confused. They could be trapped in the deeper scar, the deeper layers of the scar as it's healed. And that can just start to send the wrong sort of signals to the brain.
So the depth of the scar then is you're kind of treating it emotionally and physically.
Absolutely. I think the key with this therapy is we have to listen to the person sitting in front of us, the person that owns the scar. We're not just focusing on the scar. We want to hear their story. We want to hear how long was the surgery for, or are you happy to talk about the trauma so that we can fit together, we can piece this history up. We also need to pay attention to any other comorbidities. So, for instance, if somebody has diabetes or an autoimmune disorder or anything of an inflammatory nature, their healing and response is going to be very, very different.
And can massage actually break it down? So, for example, if someone's got a keloid, is that normally that's just going to be there forever, live with it? Or is it something that can actually be treated?
So I would, this is my kind of, what's the word, pet hate question, and I see this all the time. Yes, no, it's fine. Come and we'll break scar tissue down. I can genuinely say, if you can do that, well, there is no way that scar tissue can be broken down because it's there for a reason as well. It's healed our bodies, in a time of trauma. So we need to be respectful of that tissue. So I often hear, yes, we can break scar tissue up. As I said, it's got a very, very different concentration of collagen. It's not going anywhere. Whatever you do, you're not going to break that scar tissue up. We can soften it. Anybody that says they can break tissue up, the only way, you hear this thing of scar revision, scar removal. I've seen some scar revisions so often people have these really kind of lumpy, bumpy scars that are problematic cosmetic wise as well. Fair enough. Sometimes the surgery itself can lead to further scarring.
Yes.
So in a nutshell, it's pretty impossible to break up scar tissue.
Okay. So laser as well, that's not a thing.
Well, laser can be helpful, but it all depends on the person. It depends on their health, their general health. It depends where the scar is situated. It depends on how deep the scar is. So it's very, very individualized.
Okay. And so if somebody's at home or is thinking about having scar treatment, does it require I know you mentioned earlier about it not being your typical type of massage. Is it deep pressure that's required, what you might have with a sports massage, for example? Would that guarantee the best results, or is it different?
That's a really good question. I think that's the thing that puts sort of perhaps surgeons off sometimes recommending this therapy because, number one, we don't want to disturb the scar. We need to be, it's tissue that's traumatized. So the techniques are very, very gentle. It's very much related around the amount of tension that we're feeling. So the cause of really, unhappy scarring is just the mechanical tension throughout the body that can also put some certain cells into overdrive. They sense this tension and they're gonna form this sort of thick belt of a scar. Definitely not sports massage depth. It's very, very gentle. We are coaxing the tissues to unwind, for want of a better word. We are influencing fluid dynamics and we're working with the whole being. So no, there's never, ever should never be painful. Ever.
Right. So if somebody was going to have a massage just at their local massage place,
Yeah.
would it be advisable to say to that therapist, avoid that area? Obviously, if the skin is open or whatever, then we would expect it to be covered. But if someone's got a healed, in theory, scar, would it be advisable to say, don't touch that area, but go ahead with everywhere else?
Absolutely not. There's no different. There's no reason why we shouldn't just, what's the word, incorporate the scar into the massage that we're doing. In fact, it will be very, very beneficial as long as I've said before, as long as there isn't any pain or infection.
Mm.
They're probably, people often just perhaps forget to tell me that they have scars and they often say, oh, that feels so much better. I can breathe in now. And so it's very beneficial massage generally for healed scars. Absolutely.
Is it helpful to get sunlight to the scar?
I would definitely say no, because that tissue, again, is lacking the cells that actually kind of protect us naturally. So it can lead to hyperpigmentation. So it's very vulnerable tissue. So an SPF is vital for scars.
Right.
So sunlight will not fade that scar. As the creams that I see advertised to fade a scar, don't waste your money. They don't.
Good tip. Can you share surprising facts about scars that people may not know?
Okay. So as we said, there aren't any sweat glands or oil glands, and a lot of people aren't aware of that. So even if you can just get a bit of Vaseline on your scar, just do it. It's better than nothing. A scar actually takes around 18 months to 2 years to fully heal. And people are often surprised at that because they look at their scar on month 2 and think, oh my goodness, it's dreadful. It's all buckled and everything else. But there's an awful lot of healing. So we get that sort of primary and healing on the surface that you see, the visible scar. Underneath it, there's an awful lot going on. There are the various stages of healing of the tissues. So 18 months to 2 years. And that's really our window in. That's an opportune time for us as therapists to work with the scarring. I think the other thing that's worth noting, particularly in the UK at the moment, we've got something like 5 million people that are living with scarring that causes, real kind of psychological and physiological stress as well. So it's what we kind of class as kind of traumatic scarring, and at least 20 million, that have a visible scar. And in fact, worldwide, I think it's like something like, don't quote me, it's like 48% or something like that, every other person has a scar. We're all walking about with these things that we don't talk about or necessarily think about sometimes until they go right. And they can. A scar, this is another good, I think, a surprising fact. Any age can change. So we can work on scars when people are 90 or however long someone's alive, because we're continually regenerating, remodeling our tissues. We can work with scars at any age. So I think the oldest scar I've worked on is 53 years old. And it responded to some really, really gentle stuff, which was good. One last thing to say on that, and it's 97% of gynecologic procedures, so laparoscopies, all of those investigative procedures that, a very innocent keyhole will end up with abdominal adhesions. So when we say adhesions, it's another part of our work, the scarring. So adhesions are when tissues basically that slip and slide over each other. So if you think about sort of tissues in the tummy area, we've got quite a lot going on, slide around, tissues slide, so they start to stick together. So anything that kind of pierces that inner body stocking will have an adhesion. So that can cause a lot of complications. That's 97%. In fact, I think it's something like 90% of all abdominal surgeries result in adhesions as well. So,
and can massage help with that?
Definitely. Absolutely. It has to be kind of gentle. It's pretty targeted, but it can certainly help with that feeling of tightness in the tummy. Often people say they're unable to take a deep breath in when they've had multiple abdominal surgeries, so we can work with the diaphragm and all sorts of things. So, yeah.
And so what results would people expect to see after having a treatment?
This person that came in had had a mastectomy. And this is it's kind of a brutal image, but as you can see, the tissues are quite tethered. There's a fair bit of swelling. And she came to see me because she felt deformed. Those were her words. She felt like a circus freak. And that's something I hear an awful lot with women that have had mastectomies and have healed in this manner. She'd also had radiotherapy, so the tissues, I don't know whether you can see it on an image or not, but they're quite dry. And she wanted to wear a bra. And she just couldn't wear a bra because this was painful on the site of the scar. It was very, very painful. And I would say this is a kind of common, for want of a better word, presentation that we see these kind of scars like a couple of years old and they've contracted. You can see that deep pull inside the scar. So this person I saw her for, I think there were 6 sessions and we did one a month, and we managed to soften the tissue. We managed to get some sort of movement. She was able to put her arm behind her back to fasten her bra. She did a lot of homework, so it was a simple kind of function, restore the functionality, and then kind of rehab. And I use the word rehab in the sense of let's integrate this scar in with the rest of your movement. So we got her stretching, just gentle stretching, and breathing well, because the breath will massage any scars that we have on the torso from the inside out. So that was kind of quite a dramatic change visually. She was absolutely delighted that she just wanted to wear a bra, and going back to this sort of therapeutic relationship we have with clients. Some come in and say, I'm not bothered about the appearance. I just want to be able to lift my arm up,
Yeah.
or tie my shoes up. So we have to really listen, because we can get carried away sometimes with cosmetics, and often people aren't concerned about that. But it's a bonus when the tissues behave this way. So she responded really, really well. So I think that's quite a good example of what can be achieved in a relatively short space of time.
Wonderful. Well, it's a really positive note to end on, Elaine. Thank you so much for joining me today and for becoming part of Quality Health Finder. If you found this conversation helpful, please like, share and subscribe, and we'll be sharing more conversations with trusted healthcare professionals like Elaine to help you make informed decisions about your health. Thanks for watching, and we'll see you next time.